But worse than that, Mr. Speaker, sometimes the parents know and don't say nothing about it. We can't have this in our society. Because what it ends up with is the murder of 14-year-old girls or boys. Pregnant. We can't have this in our society. We can't. Mr. Speaker, our courts are clogged while we must reduce the backlog over the medium to long term. There are quick solutions to reducing this problem. In other countries, suspects are no longer taken to court for arraignment, but do so via video conference with a judge. Audio arraignment has been used to reduce the cost of transporting detainees. It also assists with ensuring public safety and reducing the amount of court personnel needed in the initial stage of the legal process. Video arraignment. It's video arraignment. Sorry about it. Mr. Speaker, we know how to fight crime. The facts of history show we know how to implement the solutions. This, Mr. Speaker, is the only way to move Jamaica forward from poverty to prosperity. Mr. Speaker, I have observed carefully the discussions in the media and elsewhere about health care in Jamaica. Mr. Speaker, a vision for moving people from poverty to prosperity must come from the knowledge that we cannot sustain growth without a healthy population. The abolition of user fees on April 1, 2008 at public hospitals by the last Labour Party administration represented a quantum leap towards the achievement of universal health care, greater social equity, and improved human development. The no-user fee policy was primarily effected by the government increasing its budgetary allocation to offset the abolition of fees. In the 2006-2007 budget of $19.5 billion allocated to the health sector, user fees contributed a mere $1.7 billion. In sticking to our commitment of free access to health care, the JLP administration raised the allocation to health in the 2007-2008 budget by 22% or $4.2 billion. This paved the way for the implementation of the no-user fee policy the following year. In the 2008-2009 budget, we increased the allocation by a further 25% or $5.8 billion. Mr. Speaker, the no-user fee policy actually replaced the income stream of fees, which was not always certain or even collectible, and infused net new direct cash flow into the health system. As a result of the user fee policy, Mr. Speaker, more money was given to health care than what was taken out as user fees. We do not contend, Mr. Speaker, that the increased budgetary allocations was consummate with the actual demand and desired quality of health services. What is clear is that the JLP increased funding considerably and maintained a commitment to doing so. In that regard, considerable resources were expended on improving the state of primary health clinics and facilities. We promoted the use of clinics for basic health care needs and hospitals for more serious and complicated medical cases. These initiatives resulted in positive changes in the health-seeking behavior of ordinary Jamaican. After the abolition of user fees at public hospitals, persons afflicted with illnesses, the elderly in particular, made greater use of the public healthcare system rather than suffer in silence at home. Before the abolition of user fees, thousands of Jamaicans shied away from engaging the system, and many eventually died because they were deterred by prohibitive health costs. In 2007, before user fees were abolished, there were 148,040 admissions to hospitals and 1,120,000 visits to healthcare centers. In 2008, after the no user fee policy was implemented, there were 190,000 admissions to hospitals, 42,000 more than before, and 1,270,000 visits to health centers, 151,000 more visits than before. The initial surge in usage as a result of free access eventually tapered off as a backlog in the healthcare sector were attended to. I shudder to think what was happening to those persons who couldn't afford healthcare before. Mr. Speaker, those who seek to return to user fees must answer the question: where will the people who cannot afford healthcare access healthcare? Mr. Speaker, in the 2012 survey of living conditions, it is noted that 3 out of 4 Jamaicans, 75%, who reported being ill or injured sought health care. Mr. Speaker, this is an improvement over previous years. There is no doubt that the no user fee policy has improved the health-seeking behavior of Jamaicans. But interestingly, it is also noted that 24.8% of Jamaicans who reported illness did not seek medical attention. This was down from 2002, when 36% reported not seeking medical attention. Well, the cause then was they couldn't afford the fees. Preference for home remedies was the main reason given by 48.9% of those not seeking health care in 2012. The Labour Party administration increased the health budget every year as a demonstration of our commitment to the policy of free access to health care in Jamaica. We believe that if you are sick, you should be able to go to the hospital at the time of your illness and be treated in reasonable time with dignity. There's a lot of misconception